Fantastic. And now we're going to go ahead and get started. My name is Leah Lutz. I work here at SVJI, and I'm a collaboration specialist and also the teaching and resources coordinator here. I work with teams in Minnesota and across the country one-on-one. So we'll be sharing many lessons learned as terms of forensic compliance with you today from my direct work with teams, and then also get to organize the different training events that SVJI hosts. And we have a special guest from another team on today, and she's going to introduce herself.
Hi everyone, this is Jessica Van Yperen. I coordinate the Lyon County SMART in Marshall, Minnesota. I've been doing this since about April of 2009. We are a very rural community with a population of about a little over 13,000. And I'm hoping to share a lot of fun stories with you today about our team and some of the successes and challenges we've had.
Great. Thank you, Jessica.
Yep.
So what do we hope to accomplish in today's webinar? First, we're going to give you an outline of forensic compliance, just kind of the overview of that, and talk with you about the letter versus the spirit of that and what it means for implementing forensic compliance in your community as it relates to the letter versus the spirit. We're also going to be talking specifically a lot about decision points that are really intentionally crafted to help your team navigate your way through this complex issue of forensic compliance. So how you can use these decision points to move your team closer to the spirit of forensic compliance. We're going to also give you some different resources. Other national TA providers are also providing technical assistance on this, and really have some time for your questions at the end as well. So again, we won't be taking time during the webinar to answer your questions, but we certainly will be leaving time at the end, and if we don't get to it, we'll be more than happy to follow up with you individually as well. We know that many of you are on listening as a team. I'm really, really thankful for that. And as we will go through, we will be giving considerations for your whole team to consider to implement forensic compliance. So at the end of the webinar, we just really hope that to leave you with a really good understanding and practical advice on how to engage your team in the pursuit of the spirit of forensic compliance, not just the letter of the law. If you do not have a team in your jurisdiction already, or if your team is limited in scope, we hope to give you some ideas on how to engage a broader multidisciplinary team as it relates to this. And finally, as we're talking today and through our work, we know that there is just not one model to apply in any community as it relates to this issue. And what we're doing really today is sharing our lessons learned with you. And there is no one cookie-cutter approach. And we hope to give you some food for thought with these decision points and what it means specifically to your team as you move through this really complex subject matter to navigate. And finally, we've heard from many, many teams, how do we get this done? And really our goal here today is also to help show you how to chunk it up and make it possible to move through this. So who are we? The Sexual Violence Justice Institute. We are a project within the Minnesota Coalition Against Sexual Assault. You can read our mission statement there. And we work across the nation and in Minnesota to improve the response to sexual assault across all disciplines. We work hard to equip the multidisciplinary teams and allied professionals with the concepts, tools, trainings, and resources needed to create a victim-centered response to sexual violence within their local communities. Specifically, in terms of forensic compliance, we had the good fortune of working on this for a couple of years with a special project, and we were able to develop model policies. So this webinar is, we had to work through many, many decision points ourselves as a state. The coalition, we were an opportunity to help lead that effort. So we have our own experience on how to have these conversations. And then the end result is we were able to develop model policies, which we will be explaining in greater detail in this webinar, and we'll also give you some tangible considerations that you can consider for your team. And you will also be shown how you can access the Minnesota model policies. So first, of course, let's just start with what are we talking about. Let's just make sure we're all on the same page. So what is forensic compliance? And when we use that term for the sake of this webinar, we are referring to the newer set of rules that dictate how the medical forensic exam must be offered to victims of sexual assault. These rules were articulated in the federal law in VAWA in 2005, which I know almost all of you are familiar with. Any state, territory, or tribe receiving VAWA stop grant money must certify that they are compliant with several of the requirements as it is outlined in here. So basically, you know, the nuts and bolts of it are these 2 points, that the victims must have access to the medical forensic exam without reporting the crime to law enforcement or cooperating with law enforcement, and the victim cannot be required to bear the cost of the exam. So it's free of charge or reimbursement. And here's a little bit just more language on what is forensic compliance. So we know from working with all of you in the field and in various communities that this is the actual language of VAWA 2005. However, I think one of the sticky points and one of the harder things about it is that nothing in the law specifies how states, territories, or tribes must implement these changes. So I know since 2005 that communities have been working exceptionally hard on figuring out what this means for their community, and once they have figured out what it means, how they can actually implement it and make the necessary changes so that they are in compliance with it. Okay, so that's just kind of the general overview of it. So how do you get your teams, how do you get the different disciplines, how do you get the players in your community to really start talking about this, to be engaged on it? We think that it's really helpful to go with kind of a two-tier conversation and to really start with the philosophy behind this change. And the justice in philosophy, I think, is to increase the reporting and to increase victim access to the criminal justice system and improve the same outcomes. For the healthcare philosophy, to increase victim access to health professionals and to improve the physical and psychological outcomes for victims and for their well-being. So if a victim is unsure whether or not they want to report to law enforcement, but they access that exam, oftentimes that's the initial entry point into advocacy services. They could be getting the STI prophylaxis treatment, the emergency contraception in the ER, and just really good quality care. That can give that victim a sense of well-being and can give the victim some time, you know, to decide if they want to report later on. We often use the phrase here at SVDI at Midcasa that victims often test the waters on their disclosure process. And if they test the waters with advocacy, with healthcare, with law enforcement, whatever that initial entry point may be, even an informal person, we often know that victims don't often initially disclose to the system people. But if they test the waters and get a positive response and a positive experience to that initial disclosure, that may impact if they then down the road decide to report, go further with accessing the criminal justice system. So I would really encourage you to start with your team with this. And we're going to go a little bit deeper into it right now. So what does this mean? I mean, what is this justice philosophy and how can your team talk about it? We've seen great success from teams talking about this as it relates to the letter and the spirit of the law. So the letter of the law and the language that we just illustrated and shown with the VAWA is pretty simple. It offers a medical forensic exam to victims without requiring them to talk with law enforcement. And the victim does not have to pay for that exam. That's kind of the letter of it. The spirit of it, the conversations your team can have is the victim does not need to pay for exam up front or have any out-of-pocket expenses. The evidentiary kit is stored for a period of time based on realistic victim responses. And we also know that there are system needs as it relates to that as well. Creates that process so the case conversion is truly feasible. And the cases are vigorously investigated and have a chance for successful prosecution. We know that everything we do as practitioners, if you're an advocate, if you're a healthcare professional on the line, prosecutor, law enforcement team, policymakers, we need to ask what is the purpose. So what is the purpose for providing an exam to a victim without requiring a report to law enforcement? Everyone on the webinar today, I'm sure, knows the purpose. It's just that it really helps for your team to talk about the purpose and consider it the two philosophies that we outlined easier. Easier for victims to pursue medical care and to access the criminal justice system in their own time when they are ready. And this means giving victims access to the medical forensic exam and then perhaps giving time to sleep or meet with an advocate, get somewhere safe, shower, talk to family or friends, whatever it may be that victim needs to do in order for the victim to clearly understand what options would be in their best interest at that period in time for them. I think also the purpose of the law is to facilitate the collection of valuable forensic evidence. I've heard from teams and law enforcement and prosecutors all over the country that they want the evidence, that at least if they can get the evidence that's there, if the victim decides to report later, there's a much greater chance of it going forward with that evidence. And forensic examiners are collecting the evidence but only holding it for a really short time, let's say it's 2 weeks, 10 days, whatever it may be, before destroying it. We have to really ask ourselves if the victims are told that, if that really is a meaningful amount of time in order for the victim to make an informed decision or to make a decision later on to report it to law enforcement. So think about it in your jurisdiction, how you can push your team to not only implementing the letter, but the spirit. And from our experience, when teams start transitioning to the conversations of the spirit of the law, that is where some really innovative, creative, interesting approaches are starting to take shape in a lot of communities. And finally, and throughout this webinar, you're going to hear us, and we have different language that we have developed. So for example, you're going to hear us using the term converted. And we're going to talk much more about this later. But it's a term that we use to describe a case where the victim wasn't initially sure whether to report and later turns the case into a standard report with law enforcement involvement. And as you'll hear later, that we have chosen this language for very specific reasons. And as I mentioned earlier, we had the Minnesota Model Forensic Compliance Project. We had a lot of discussion with our stakeholders, with multidisciplinary teams on language, how we can use this opportunity also to kind of reshape how we're thinking about this issue, how we're thinking about sexual violence, and how we can give more consistent victim-centered messages in our community and on our teams. So here's your ultimate question, and I don't think it's one that's super easily answered. So consider, in your jurisdiction, once the medical forensic examination is provided to a victim of sexual assault who has not yet decided whether to report the case to law enforcement, what happens next? Is there a smooth transition process? Do you have things like chain of custody figured out, storage duration, location, and so on? And then the second part of that question, which I think teams are starting to have some really fascinating conversations on this as it relates to this. In your jurisdiction, is there any possibility that converted cases will be successfully investigated and prosecuted? So for example, the language it converted, and why I think this part of this question is really getting interesting. I get to work with the Southern St. Louis team up in Duluth, Minnesota area, and they have some great templates and policies as it relates to this and anonymous reporting and different reporting options, which we'll show you some examples here in a little bit. But their team, their prosecutor, their law enforcement, the advocates, medical, all together had great conversations about what it would mean to have successfully converted cases. So their prosecution, their team has really made a deliberate decision not to use the word delayed reporting. And if the victim does choose at a later date to make that full law enforcement report, that it's not viewed by the prosecution office or by law enforcement as a delayed report. It's viewed as a converted case, as a new case, and they're taking great strides to investigate that just as vigorously as they would a case that was a few days old. Now, given that, they realize that there's different constraints that puts on the system, different pressures. Suspects may be harder to find, ear witnesses and things like that. The teams are having some really creative discussions on how they can do that and implementing other strategies and figuring out what can be successful. For example, the pretext call or the controlled call. And I think, too, that we found with teams, to kind of take it back, as it relates to forensic compliance, what does it mean to have a victim-centered approach? These are some ideas that we have at SVGI for victim-centered that we promote with teams and that teams have helped us develop. So you can take your team's ideas of what is victim-centered and apply it to forensic compliance. And Jessica, who you're going to hear from in just a little bit here, as she talks about what it means from the team level, is going to share with you that when her team got stuck and navigating through some of these decision points, when their team wasn't quite sure how to arrive at consensus or what would be the best thing to do, they often took it back to this. So what could it possibly mean for having a victim-centered approach for forensic compliance? So what does consider the victim first mean in this? I think it means that you consider the victim's point of view first and not the agency's convenience. Listening to the victim articulate his or her needs, it doesn't assume what's best for him or her is always best for the system. I mean, best for the system probably would be to report, earlier and get more opportunities for evidence and interviews and so on, but that may not be the best outcome at that time for the victim. Promoting the victim self-agency, I think, is the meaning to provide options and time to make informed decisions. So how do you do that as a team as it relates to this, to give the time in order to really, truly, honestly give that victim the opportunity to make an informed decision that's in their best interest? The victim safety, there are many, many very good reasons why a victim may not want to report immediately. And it could be out of safety concerns in a rural community. It could be of confidentiality concerns on a campus, fear of everybody finding out. There are just so many valid reasons why a victim would fear the safety. Coordinating and collaborating in the victim's best interest. I think that's really what we're here to discuss today. How to collaborate to be sure that your community is pursuing the spirit of compliance. And by creating a system that meets the needs of the most vulnerable individuals in our community, we can ensure that more and more people will have equal access to justice. I think that if teams can figure out a way to give the most vulnerable populations, those could be those victims that we know are the majority of victims, those victims that have a high level of vulnerability and perceived low levels of credibility, maybe a woman that's being used in prostitution, maybe a victim that has a warrant out, maybe a victim that's on probation and doesn't want to report because she was using at the time. And I think that that's where this gives your team, your jurisdictions, your community a really, truly unique opportunity to implement new reporting options, new ways of managing forensic compliance, so that some of these victims will see the criminal justice system as a viable system that they can access. They'll be safe, that they'll be taken legitimately, that they can actually report without fear of reprisals from the system, and instead that they feel like the system will uphold them. And finally, a great opportunity to hold yourself and others accountable, and the opportunity for your teams to ask the difficult questions that really gets to is what you're doing, what you're going to propose to do, really meeting the spirit of the law. If you've already implemented some things within forensic compliance, it would be a great time to do a little check and balance and see, is this meeting the spirit of the law for what we want victims to receive in our community. So just wanted to share with you briefly just a little bit more here about Minnesota and why we have some good practice on helping teams navigate their way through decision points. Because in Minnesota, we do have a statute in law that went into effect in 2003 and enacted prior to the VAWA 2005 mandates that puts us in compliance with VAWA, that victims don't need to report to access the exam. However, we have in Minnesota 87 counties doing it 87 different ways. So, for example, the county-based payment scheme can be really burdensome for our hospitals, and in our statute it states that the county is responsible for the payment of the exam. However, it does not say which entity within the county must pay for the exam. There are no specific rules or regulations regarding how long the kit must be stored, where it must be stored, any few thoughts on the converted cases and things like that. So we've had a lot of opportunity to work on some of these things that go county by county for us, and that we also realized as we were working through this that few jurisdictions had written policies on this. So basically, like many communities across the country, we were technically in compliance, but we had some ground to make up when it came to really implementing the spirit of the law. And likewise, across the nation, we also know that there's wide diversity. Many states have implemented reforms. Many states do have statutory statements on the exam and things like that. But we still know that implementation across the nation, is really, really diverse. And we also know that there's many professionals working to achieve the spirit of the law, and many other national TA providers, which we'll give you some information on, such as EVA, have worked really, really hard, and we've learned from them on how to implement the spirit of the law. So that's the basic overview and our experience of it. And now we're going to move more into models of compliance and versus the decision points and how to navigate this as a series of decision points. So we've been talking a lot about that, but actually how do you use them in your state in this pursuit? Be aware that as we propose some of these different models, and as Jessica's going to share the lessons learned from her team, we know that there's not a one-size-fits-all. You can't just pick one model and apply it to your community, but we have found that this is a strategy that, if implemented, does work to help your team find some really, really good, viable solutions. These models and associated considerations are offered to give you a place to start. We've offered them and then have seen teams, make them even better and have additional ideas and considerations that they feed back to us. Basically, we're learning all together. I don't think that we have it all completely right down either, and just really, really want to state that we want to hear back from you, because I think as we all navigate this together, as we all have conversations about it, we're developing more and more innovative solutions. And again, if your team gets stuck, go back to the what is the purpose. Go back to the philosophy of it. Go back to the increasing access to the justice and the health care. That will really, really help your team. And finally, just a note, we're going to talk a little bit more that we know different states have different pressures on them as well. So, for example, we know that medical mandated reporting is in some states, and we don't view that as a model, but rather a factor that you must consider depending on the laws of your state. And we're going to discuss that separately after we give you a general framework of these models. All right. So we're going to go through the next 2 slides, and these are going to be the areas, the decision points that we have seen that if teams have conversations about, troubleshoot around, find solutions to, it brings you incrementally closer and closer to the overall goal, which is complete compliance with forensic compliance, and hopefully actually working to really improve the experience for victims and improve the justice system outcomes. So, and depending on where your team is at with this, there's going to be different questions that are fit for these, for you to consider. So how will victims be connected with advocacy is essential through all the different entry points in the system. So if they enter the healthcare setting first, how are they going to be connected with advocacy? If they report first to law enforcement, how are they going to be connected to advocacy? If it's tribal, if it's campus, if you are dealing with multiple jurisdictions and multiple advocacy agencies, what are the linkages? Where will the evidentiary kits from cases where the victim hasn't yet decided whether to report to law enforcement be stored? And we are calling those restricted kits. The kits where the victim is still deciding to report to law enforcement. That was, again, a deliberate use of language on our part, and oodles and oodles of hours of conversations to arrive at that term restricted kits. What elements make up a proper storage facility? We know that kits across the country and in Minnesota are stored in various locations, usually within law enforcement or the medical exam facility, or sometimes the family advocacy center. So what makes your decision on where to store it a good, viable, proper storage facility that will meet the needs of prosecution and law enforcement for chain of custody and so on? So if not stored at the exam facility, how will restricted kits be transferred to the storage? How are you going to ensure the chain of custody in your community? How will the anonymity of the victim in the restricted cases be protected? We're going to give you some specific examples on that. How will restricted kits be inventoried or tracked? How long will the restricted kits be kept? This is the duration, and we know that it's being kept for different lengths all across the country, anywhere from just a few days to the statute of limitations, to indefinitely. How will case conversion be made feasible for victims? So they have the exam, they haven't yet chosen to report to law enforcement. How are they going to know the process in your community to make that case conversion, to go to law enforcement once they feel settled, once they get a great response from that healthcare professional and they feel like, hey, this wasn't so bad, they believe me, I was able to get some really vital services that I needed, I think I'm ready to go forward. How are they going to know? Once they're ready, how are they going to know? How will your jurisdiction ensure the converted cases are investigated vigorously? Again, we know that there are legitimate barriers to that, but we also believe that there are really legitimate solutions to that as well. And if your team has already have some policies and procedures in place, if you know where these restricted kits are kept, how long they're stored, so on, this may be your next place to have a conversation in your team, is what is happening to these converted cases, and how can you have a chance for success with these cases. How will your jurisdiction ensure that other issues don't prevent victim access to the exam? We're going to talk about other issues in greater detail, but we know there's the reality of limited resources for many, many communities as well. So I mentioned healthcare professionals and the SANE and the SAFE programs. We know that many areas, rural areas, not always rural areas, don't have access to a SANE and SAFE program. So in your community, what else needs to happen in order to ensure that some of these other harder issues that we know are hard to solve, but sometimes can be wrapped up in this, and you can at least move towards solutions. that don't prevent victim access to exams. So we know that the competence and confidence of healthcare professionals or settings that don't have the SANE or SAFE program can sometimes be a barrier. We know that long transportation times for victims can be a barrier, and there's many, many other barriers, as you know, that are in play in your communities as well. So now we're going to talk with here Jessica, and you can see I'm sitting in St. Paul at our office here at SVGI, and Jessica is in her office in Marshall, Minnesota, in southwestern Minnesota, and she's going to share some lessons learned now about how she used the decision points with her team. Are you there, Jessica?
I'm here.
Hey. So let's just start with the beginning. What were some of the decision points you have guided your team through?
Yeah, well, we looked at many of the decision points that you just highlighted, Leah, but more specifically, we went through how to get an advocate involved in the response right away, no matter where that victim reports to. We also discussed case conversion, and we're still kind of in the process of that now. We looked at the exam time frame for forensic exams. We've looked at restricted kits, and we've also done a lot of talking about restricted kit storage and duration.
Great, thanks.
Yeah.
So for exam time frame, I know your community was at 72 hours, and then you moved to 120 hours. Is that correct?
Correct.
Right.
Well, there was a couple different times we had down, but we're now at a consensus of 120.
Okay. So, I think that it's really worth noting that through these conversations, other areas as it relates to the exam were also brought into play. And I know that we talked, about how your team brought in best practices and research information, and how it was an opportunity actually for your team as you went along to make other types of changes as well.
Go ahead.
Go ahead, Jessica.
No, go ahead.
Yeah, so tell me, what are some new things that your team has developed because of these conversations?
Well, one of the new things specifically was the getting an advocate involved right away. We have, we call them core disciplines, or core agencies, so law enforcement, medical, advocacy, prosecution, and probation. They all, we worked on making it sure that each protocol for each of those agencies was getting that advocate involved right away with the victim, even if it was later down the road, such as prosecution or probation. So we really worked on connecting that victim with an advocate when they first started working with that agency, just to make sure it was a service that was offered to them. So that was something new. We also worked on some multiple reporting options, and we're going to be looking at an example a little bit later, but we worked on a restricted sexual assault documentation form. And we also discussed, how a victim could convert a restricted kit. So then we looked at what other teams throughout Minnesota had done and chose to create a card for victims with instructions for how to convert on one side of the card and then kit identification info on the other side of the card. So we have a lot of paperwork ready for victims if they choose to go with a restricted kit or a restricted report. Yeah, and we also, like you said just a little bit ago, is we switched the time frame from the 72, 96 to about 120. So those were all some new things that we got accomplished.
Great. So how would you describe the tone of the conversation?
Well, when we were talking about involving advocates, that was a pretty light, easygoing. Everyone understood the importance and the validity of getting an advocate involved. So that was an easy conversation. The tone was good. When we started talking more about restricted kit storage duration, the conversation got a little richer. As I imagine most of you can understand, prosecution and law enforcement had their concerns with holding a restricted kit for a long period of time and how that's going to impact the ability to prosecute and the chances for success there. And so that's when we kind of brought it back to, okay, we'll explain to the team how this is going to affect your role or your discipline so we can kind of understand your perspective of this. And then once we've talked through that, let's also then look at how is this going to be victim-centered. Is it going to be more victim-centered to store the kit for just a small amount of time, or is it going to be more victim-centered to store it for a longer period of time? So those conversations were a little bit more rich, but in the end, when we brought it back to victim-centered, everyone was kind of like, okay, we can work on this and we can find a solution together. And a lot of the team members would echo that, okay, but what's going to be the most victim-centered?
Right, great. So how did the decision points help?
Oh, they were fabulous. The decision points, I took them and put them into just a PowerPoint so that it really broke down and made it easier for us to discuss one topic at a time. It made the information easier to talk through and then ask, is this an option for our protocol? Is it even an option in our community? So, for example, involving advocacy services. Once we went through the best practices in the decision points, then we kind of stop here and say, okay, what's currently being done? We go around the table, what's being done in your agency? What do you think of the recommendations of that immediate call to an advocate? What do you think about the advocate either staying or leaving if the patient or the victim declines to have those services? And so it really made the intangible tangible and made us have this ability to have a conversation that was very guided. It was helpful having the information about other options so we could start that dialogue and then bring in different perspectives. It also helped us think about what wasn't in our protocol or what wasn't on our team's radar. So when I had said before, connecting advocates with the Department of Corrections or probation, as the team went through these model policies such as involving advocacy services, we learned that we didn't have that connection with the Department of Corrections. They work wonderfully and we help them with community notification events and all that, but they weren't always connecting a victim to an advocate at that stage of the process. So we also learned best practice was to get them involved and that there are options that a victim can offer, or an advocate can offer a victim at that point. We also learned a little education along the way. When we were presenting on the exam time frame, a lot of us didn't know exactly why, myself included, the 72-hour time frame was what we had stuck with. I know as advocates, the 72-hour time frame is what was told to me when I started as an advocate. Law enforcement, who is our county payer, said that they went under the 96-hour time frame, and medical kind of said, we'll go with whatever. We don't have a time frame in our protocol, and we don't even have a protocol. So in the model policies, it outlined that the reason the 72-hour time frame was really highlighted was because it was the most effective time frame for prophylaxis and emergency contraceptives to be the most effective. So we learned a lot, too, from the decision points, just education and best practices. So we had a really great opportunity to look through the decision points and then to incorporate some of those changes and suggestions into our protocol while we were writing them.
Great. And I know you're not done with talking through some of these issues.
Mm-hmm.
Tell us, how long so far has it taken your team to process through the decision points and what you have done so far?
Yes. I laughed because I sometimes tend to bite off more than I can chew and thought we could get through like 3 or 4 of the decision point model policies in a meeting. Well, our meetings are an hour and a half long and we meet once a month, and that was not the case. We got through probably about 1 or 2 decision points at a meeting because we need to really stop and say, okay, does this make sense to everyone? Is this going to work? Can we put this into our protocol? So, yeah, it took us a while, and like you said, we're still kind of working on some of those conversations, and then we'd have to go back and ask our technical assistants, SBJI, for questions and clarifications and more best practice and more research information that I could bring to the team and we could continue our conversation with.
Great. Thanks, Jessica.
Yep.
All right, so Jessica brought up a few issues as it relates to her team, and I just wanted to state just a couple of others. We know another issue is ensuring victim access to the medical forensic exam without cooperation with law enforcement is worthless if what we were saying before, the healthcare professionals do not feel confident or competent to provide the exam, and the medical mandated reporting is misunderstood. So let's go with the first bullet point there first. What to do if your team is in one of those areas where basically you may need some other things to happen along with forensic compliance in order to truly give victims access to the exam. And what we've seen work really well in many communities is a 2-tier approach. So have your team work on the protocols, work on the forensic compliance, but also work on ways to increase the confidence and competence of the healthcare provider in your area. Because oftentimes their fears are legitimate, and once we take the time to listen, most of the time they're just afraid of not serving this victim well or doing something wrong, misplacing the evidence, things like that. So how you can help your community and your healthcare implement protocols that make sense for their hospital setting, but also how you can increase access to the training. And we know, for example, like IFN has an online certification now for SANE. You can bring in neighboring SANEs. We've seen this work in other communities to another hospital to do some basics of the exam. You can increase the skill level while you're also increasing just your overall community's response. And then finally, the medical mandated reporting is misunderstood. And so some states have the requirement that healthcare professionals do report to law enforcement when a patient, usually defined as competent adult, discloses a sexual assault. So we just wanted to state this. OVW has stated this does not violate VAWA 2005 because victims do not have to cooperate with law enforcement for the report. But states differ whether victim names must be provided. We know that on the webinar today we have some of our state coalition folks on the line. This would be a great opportunity as well to tap into the expertise of your state coalition as a result of specific state laws and what it may mean for implementation. All right, so one model. And if you want greater details of this, at the end of the webinar, you're going to be given the link to access the Minnesota model policies as well as some great information that Eva has on this as well. So one model is that victims are offered a medical forensic exam without requiring them to talk with law enforcement. So we're kind of all on that same page now, but how do you make it actually happen? So we wanted to give you a couple things to consider. So we've seen it happen in a variety of ways. These are two ways that I'm going to describe to you now that are working pretty well in communities. So one option is the victim is there. The healthcare professional calls 911, so they're dispatched for an ICR number. And they do not give out identifying information. They give out usually the location, the general jurisdiction of the assault, because we know most communities have multiple law enforcement agencies within, usually a fairly small geographical area. So they give out that so that they can create an ICR number. And the ICR is coded as CSC, anonymous, or informational only, and no investigation is triggered. But that is how the law enforcement report is generated. And then what happens is the ICR number is put on the outside of the kit, the evidentiary kit, not the victim's name. Now, some jurisdictions have not done the step of calling 911 and getting ICR, because that can oftentimes mean changes for dispatch as well. For example, this community had to add the code of CSC anonymous. So another option, and this is from a SANE program here in the suburbs of the Twin Cities area, is on their exam, they put the name of the safe for the SANE program. So this is Mercy Hospital Safe Exam with the date of the exam and then the medical chart number. And that is what the identifier that is put on the outside of the kit and not the victim's name. So we've seen communities implement it kind of either in a couple different approaches, getting the ICR number and the relevant changes that need to take place in order to make that happen, or going the route of working with the hospital setting, the medical setting, in order to think of another identifier that can be put on the outside of the kit. And then so what happens? What's it like for the victim once that this model is in place? So what we've seen then is that teams have developed a little business card to give to the victim at the time of the exam with information on how to convert the case. So it has that ICR number or other, the medical identifier number on it. Almost always there's the phone number for the advocacy agency, or however in your community you decide who that victim needs to contact in order to convert the case. Most of the time they have gone with the advocacy agency because of initial support, and then they can help the victim navigate the options when that victim chooses to convert their case. And then a destruction date for the evidentiary kit. So the victim knows how long basically they have to make a decision on whether or not to report before the kit is destroyed. And then there can be other considerations after this. So then some teams have had conversations while you have the date that the kit will be destroyed on this little card, but should they get a phone call? What should happen in the spirit of the victim-centered, in the spirit of what would be best for the victim. So your team can take this one step further. And then so after the victim leaves the exam facility, again, most teams are choosing to have no or limited interaction there with the law enforcement if they don't want involvement. After the victim leaves the exam facility, then law enforcement is called to take custody of and transport the restricted kits. Now, in some settings and Sane Safe programs, they are storing the kits on site and have a chain of custody, and as we were saying before, a proper storage location. In Minnesota, the kits have to be refrigerated. We know some kits use dry kits and they don't need to be refrigerated. Some states do that. So you need to figure out in your community where is the most viable storage location. And most teams have had that conversation on basically what will be best for law enforcement and prosecution, that they can prove the chain of custody was upheld the entire time and so on. And then in this model, law enforcement has no identifying victim information. And this is one version of anonymous reporting, which we know that we've heard different terms, and anonymous means different things to different people, but this is one option of what we would consider a version of anonymous reporting. We have found that implementation of any model requires collaboration with the forensic examiner program. If there's not one, the other healthcare professionals in your community, such as the emergency department staff, community system-based advocates, prosecution, law enforcement, and then others in the community response system, campus, military, tribal. Where are the victims in your community? Where might they go for service? Where might those initial entry points, access points take place? And consider who you need at your table to work towards the full spirit of implementation. Determine what's best for your jurisdiction. If you have campus, we strongly encourage you to have campus. I work with some teams that actually have same start campus-based on that, and reporting options as it relates to that as well. Another challenge that we heard is, you just can't do it alone, and we've heard this over and over again, is who that you need at the table. Sometimes, even though that we've given you those ideas to consider in the previous slide, you may need to widen your circle, and you may need to invite the 911 dispatch. You may need to invite additional staff like the evidence person within law enforcement, the record keepers, the hospital legal counsel and billing staff. Sometimes the issue actually gets stuck on these little points. So sometimes if you can widen your circle, you actually figure out what the sticking points to implementation are. And unless you do that and have those conversations, you're not going to know. And finally, I think the most important point for this and for this slide to take is that all disciplines must contribute for the best case outcomes. So, for example, that you need prosecution weighing in on chain of custody, and to really have the conversations that you're not trying to exclude law enforcement. I think that some teams and some law enforcement can feel like they are victim-centered, like they are going to really do, that you have policies and procedures in place. But the goal here is actually to include law enforcement and hopefully to increase the access, to increase the reporting options. And if you can get a system in your community in place where those most vulnerable victims eventually feel like they can even report to law enforcement, I think that you're going to find that you're going to have increased access to it. But we've seen that over and over again. Don't frame the conversation excluding it, because you're all on the same page, and most of us are on the same page that we want to increase the reporting to law enforcement. There's just some really, really legitimate reasons why that doesn't necessarily always happen, and that we think this will give us an opportunity in the long run. We don't know yet. I mean, we don't have a lot of information yet. Will increase the access to the criminal justice system. Another challenge, no matter where you're at with this, no matter where you're at on the compliance spectrum, you're going to have the question of, this is a really big problem, and where do you start? And again, I can't say it enough. Chunk it up. Acknowledge that it's going to take more than one meeting. Start small. Do one task at a time. And then do some sort of self-assessment. We're going to give some tools here at the end, and Violence Against Women International has a great self-assessment tool. Access the SBJI Minnesota Model Policies for Forensic Compliance. And if you're a newer team, or if you're struggling where to start, or if you're on a venture team but you have work to do on this, we really encourage you to do some sort of self-assessment form. A colleague here, and she was working on that, really adopted and used a lot of the EVA tools in a self-assessment form. And what we did here is we took it and made it into a simple true and false quiz. It was a one-page. As it relates to forensic compliance, it was non-threatening. The different responders didn't turn it in, but it really gave and it really illustrated very quickly what they did know about it and what they didn't know about it, and where they needed to go as a community and as a team as it relates to it. So a really nice, easy, quick, accessible way in order to do a self-assessment. Now, EVA has more forms that can go into greater detail and things like that, but that can be a great start and a great tool for teams to use. And now we get to hear from Jessica again, and she's going to share some of the implementation and challenges from the Lyon County team. So Jessica, let's just start big and just ask you to describe some of your implementation challenges.
Definitely. I have a few of them, so here we go. One of the implementation challenges was that time frame for the forensic exam. As I said before, we were kind of all over the spectrum. Some places were 72, some were 96. And I think 120 hours wasn't even on the radar yet for our team. It was just something that was found, that we got information from you at SBJI about as best practices and in the model policies. So we really looked at getting the right people involved to have this discussion and to work on this challenge. So we really need to involve our county payer, which is our sheriff's office, and then we had the ER manager involved, and then the ER doctors, of course. And we were looking at the current practices and then education of best practices, again, the 120 hours. And so we, I believe, met for about 3 separate meetings to really hash that out. And there were some side conversations between the ER managers and the doctors to kind of see what their take was on it. So that was definitely a bit of a challenge. We met some resistance, but in the end, the county payer was very much sure, yep, 120 hours sounds good. Once we looked at the research and we looked at best practices, and then the ER came along, and now in their protocol they suggest doing an exam up to 120 hours. So that was a little bit of a challenge, but good conversations. We also had a little difficulty with the storage duration of a restricted kit, like I said earlier. Looking at that 3-year time frame is what our team decided on. But we did have prosecution and part of our law enforcement that really wasn't on board with that. So the team had to have a couple meetings about that where we had some really good discussions and finally came to the solution based on how much to inform the victim of what their options are. So we wanted to make them informed about their options, that they could have a restricted kit done and all that, and it could be held for up to 3 years, but they also need to be aware that the investigation, the prosecution becomes more difficult with time. So really setting up those realistic expectations while also encouraging the victim to make decisions that were best for them. So that was kind of a bit of a challenge, but that's how we're implementing it. And then also through our conversations, we realized, like I said before, there wasn't that direct connection with probation and advocacy. And that was a really easy idea to implement, and we weren't aware of that it didn't exist until we started having those conversations.
Great, thank you. I should note here too, when you, if you look at the Minnesota Model Policies, we do give some ideas on the kit storage duration, and why in our policies it suggested at least 18 months. Now we know that optimal would be even longer, but we know many communities also struggle with storage space and things like that. So in that you can kind of see the rationale behind some of the suggestions and the recommendations that we came up with that you can also use with your team as you're having these conversations. So I know your team talked a lot about what successful conversion would look like. So tell us what your team did to potentially impact this.
Well, as you said earlier, with VAWA, a victim can have a forensic exam done without having to report to law enforcement. But we kind of discussed what about those other details that would be asked of a victim in a law enforcement interview, such as witnesses, information about the scene, that kind of stuff. So our team had some good conversations about the complexities of creating a document sheet involving victim confidentiality, victim-centered, agency roles and responsibilities, and all that. So we had some great conversations about that successful conversion, what it would look like, and what we want. And we wanted it, if the victim chose, a way to capture that information if later the victim decides to convert their case and make a full report to law enforcement. Law enforcement then would have the information they need to, vigorously investigate that case and a chance to improve the outcomes. So to increase the chance of successful conversion, we created a 2-page form, and we called it a restricted sexual assault documentation form to go with the restricted sexual assault kit for victims to document what happened. And this form is something that victims will take with them, and they'll complete it if they're interested in it. So this first page here is the restricted sexual assault form. It has up there the ICR number that they would put in there, and that would be the only way to identify whose form it is. And again, like I said a minute ago, this would go with the victim. And this just explains that what this form is designed for you as a victim to capture any details that you remember at the time, and that you could use later if you chose to report to law enforcement. This could aid in the investigation. And as I said earlier, the law enforcement and prosecution really wanted us to highlight investigating and prosecuting your case may become more difficult as time progresses. We also talked about this as almost being a guided journal too, so a victim could have that if they wanted to use it as a journal as well. So then on the inside page, we have information about the restricted sexual assault, so they can explain anything that they remember about what happened, sight, sounds, smells. We're learning a lot about the tactile and the different senses the victim can capture, and that helps with investigations. If you look at some of the research by Dr. David Lisak, we've been pulling some of his research and using that in this question format. And again, with some other things about who did you talk to after the assault, were there any other people present during the assault, just some things that law enforcement would more than likely ask during an interview, and this was aided by law enforcement in creating this document. And then on the next page is more of the suspect information. So the victim could document any of the suspect information they remembered. And then the last page is the things remembered section. So this could be used more as a journal, or as we know, victim memory is not instantaneous. They remember all the details right away within so many hours of the assault. So this was a place for them to maybe jot down things they remembered later on and not immediately. And we ask that they date their information, that they put it in there if they can. And again, it's their choice whether they would want to turn this in if they were to report the assault to law enforcement. So it's just really a way to overcome the challenge of, great, we have a kit, but we don't have any of the other information. This is so many years down the road. And then we also talked a lot about victim confidentiality, and so that's why we chose to put the ICR number on the front of the kit versus names or anything like that.
Great, thank you.
Yep.
We see some questions coming through the chat. This document will be given out as a handout after the webinar and some samples of the victim card. We just wanted to have an opportunity to explain what they were, and that's why we didn't send them out with the initial meeting reminder, but you will have access to that, and it will be given to you in the post-meeting notice that goes out. So how did your team actually arrive at consensus?
Well, at our first meeting, which was about a couple weeks after our initial training, our initial 2-day training, we finalized some of the team norms that we had developed, and decision-making was one of those norms. So what we do is really a majority vote, and if anyone feels the topic that we're voting on needs to have more discussion, or it needs to be more of a secret ballot, then I will create a SurveyMonkey account and email them out the question that the team is deciding on, and they can send me some information. And so we do that for a little bit more of the difficult discussions and decisions. And it gives team members a chance to elaborate if they're not comfortable at the meeting elaborating. So for example, with the kit storage duration, for those restricted kits, for them being stored for 3 years, we decided on it being stored for 3 years after we went around the room and kind of did a vote. We also talked a lot, like I said, about those model policies and what statute of limitations could be applicable and what are not, and then came to that majority consensus. And our team is also very good about saying, okay, if this is something that becomes something difficult for the responders and it's not working well with the victims, we can definitely go back and readdress. So.
Great, thank you. So in prepping for this webinar, we had talked about it can be a challenge for the coordinator on how you get to the next steps, how you keep moving your team forward. Can you say more about how you kept your team progressing through this?
Yes, definitely. I try to create a safe environment for all types of opinions, strong, not so strong, because it becomes difficult to move on to the next topic or to work through a discussion point when strong opinions start off right out of the gate. So I tried to make it a safe space for everyone's opinions, but also when I did have a strong opinion, I'd say, okay, now let's see if the other side of this situation. Can someone give me an example of the opposite side, so that all opinions were safe and that we were thinking about it from every perspective, or if anyone was questioning the idea, so that I was the one asking for this information. And also, we really wanted to have everyone on the same page, especially the non-core disciplines. So members on our team from public health or human services, and members from the college, so they're not always working directly with victims or in the victim field, sexual assault field. So I always wanted to ask, is this making sense to everyone? Because if it doesn't make sense to our non-core disciplines, I have a hard time believing it's going to make sense to the victims who are walking through this process with us.
Great, thank you.
Yep.
All right, so another challenge, Jessica referenced a few, is that you're not on the same page. So some ways that you can really work to alleviate this challenge is take time to understand each team member's roles and perspectives, even going around the table and saying, how does this relate? How does this decision impact your role, your perspective? What do you think? We know that sometimes when victims are faced with all or nothing, they usually choose nothing. So that's why I think this is such a great opportunity within your communities to come up with the multiple reporting options, come up with the multiple access to justice for forensic compliance, because overall the long picture that might impact more victims coming forward. And by establishing a system that lets victims make decisions one step at a time, may be more likely to convert to a standard report and participate in the future. So just as it takes your team time, consensus, conversation, sometimes changes in policy, sometimes changes in protocol, adapting new things, bringing in best practice, best research. sometimes it takes victims time to make those decisions as well. So really framing forensic compliance as well is that it can be incremental. It doesn't have to be the all or nothing approach, the full-fledged reporting and getting the exam and investigation. Certainly that does happen at times in communities, and we know that will continue to happen. And if that's in the victim's best interest, that's great. But how we can also move it along for the victim incrementally in order to have the future participation. Consider using a speaker from outside your team or other resources for this. Jessica talked a lot about how it's really helpful to use the resource of the policies and create the PowerPoint, because it gives your team somewhere to start talking. It gives your team some points of information that they may or may not have yet considered. And you can also consider a trial period and reevaluate it. So if your team is making some decisions that you're really not sure about how it's going to impact your community, maybe you are making a decision to store the kits longer. However, you're unsure of how this will impact storage space, and if in the long term you'll be able to hold the kits for as long as your team has considered, make it a trial period, and then reevaluate. Do you have the adequate storage facilities? That can be another great way of changing and shifting paradigms while also understanding the realistic conditions that face all of you in the field. So I remember when I first started here at SVGI, I had come from a team in a community-based advocacy program, and I took on the task of understanding what anonymous reporting was. And I learned just how many different terms there were. Jane Doe, anonymous reporting, we could go on and on about the language that we have used. And here, this is really your chance to be really intentional about the language that you're going to use. So we know that there's realistic pressures on the system. We also know that there's realistic pressures that all of you are facing in your community in what victims believe about sexual violence, what jurors believe, the general community perception, what other responders believe. We know that you face that every day as well, and that impacts the work that you do. So I think this is our time and our opportunity, and have discussions with your team about the language. For example, for years we've heard the term delayed report. We know delayed report is the norm. Most victims do not report right away. So for example, it was really intentional not to use delayed report in this, but use converted report. The victim just needed that opportunity, that time, to decide whether or not to participate in the investigation, whether or not to participate in law enforcement. So this is your chance to hopefully influence some shifts in your community as well. We know that victims will think that they did something wrong if they didn't report right away as well. Victims often, self-blame for so many different aspects of the assault, but so many different aspects of their decision-making again. So if we can start to shift the dialogue in your community, I think that has a potential of really impacting things down the road. So have those conversations, and if your team is at the spot where you already have some policies and procedures in place, this is a great place to start talking and continue talking and use it as an opportunity. And I want to say that we have a couple of folks from EVA on the line here as well. I just really want to say I know that they worked a lot with my colleague and us at SVGI and did a lot of this work and continue to do a lot of this work, have resources and tools available for you as well, but that we took a lot of learning from EVA and together too on the language and how to present this to teams and different professionals. So you may all mean something different, and that's fine. It's fine that you're all on different starting points, but how can you get on the same page? And while you're getting on the same page, how can you actually impact it and create some shifts to maybe combat some of these really prevalent myths that still surround this issue? And we know this can also be a challenge. There's existing policies or laws. There can be existing state statutes. For example, the confusion over medical mandated reporting. There can also be existing agencies and policies that won't allow for the change. And our experience with this, if you really start building this up and your response up from that point of view of philosophy, that can really, really help think about what needs to change in policy and law as well. And that could just be the reality in your community, is that you're going to also need other things to change in order for you to get to your vision of forensic compliance that your team has. And that's okay, but you can do things and have strategies to build the key partnerships. Make sure those in power and leadership positions are aware of this, are aware of the changes. You can have departmental leadership. If certain disciplines in your field need to change, you can create specific caucuses or communities, meetings around that subcommittees that relate to that particular discipline, how the team can support it, but also for your team to give really clear reasons about what needs to change, why it needs to change in order for your team and community, your jurisdiction to be fully compliant with forensic compliance. And I have to admit, I've heard this one many, many times, is everything's working great and we don't need to write it down. That can be very tempting in smaller communities or where you've kind of worked together and it's informally based. You need to write it down. There's a number of reasons. It protects against agency turnover. Sooner or later, people retire, they get another job. There's funding cuts, who knows what happens, but we need to do that. It facilitates a deeper understanding of each other's roles, and it leads legitimacy to the process to make it real. In our opinion, I think in my opinion, it's one of the most important reasons to put forensic compliance policies into writing is the legitimacy it lends to these options. It's not something that one law enforcement and one advocate decided to do together. This is a legitimate community option, and this is the response that's going to be given to all victims, no matter where they entered, no matter their circumstances. Every victim of sexual violence in your community is going to have the same access to the criminal justice system, to forensic compliance. And it's not going to matter if the day before the ED manager retired or the same nurse has moved on or that one great law enforcement ally is no longer there. You're going to have long-term consistent policies and protocols in place. And I've seen some questions come on the chats, great questions about converting. No victims in our community are converting their cases to standard reports. We've never had a converted case investigated or prosecuted. I know EVA, in their survey they did, is starting to collect some data on this case conversion. Some communities that we're working with are collecting it. We don't have great reliable data yet, I don't think, on victims and converting, or even why they choose to convert, what elements need to happen in their lives in order for them to make decisions, which we know would be varied, of course, and be different for each victim. But we just don't know. But we can consider this. You can consider how easy is the conversion process. Do victims really even know what will happen? How informed are the victims? How realistic are you being towards those victims? How involved is advocacy? We know that the involvement of advocacy is crucial for victims to stay engaged in the lengthy criminal justice process. It can be years if some cases go to prosecution, that the victim has to hang in there. So the involvement of advocacy early and often. How informed is law enforcement and prosecution? Are you on the same goal that you're not excluding, but you want to bring in their expertise? You want to create a system that works for their roles and their disciplines as well, their needs, but also works on behalf of victims and what you're trying to achieve. You can consider public service announcements or other outreach. We know, like, for example, the Austin, Texas Police Department has great PSAs, brochures, posters, websites. I mean, once you get a system in place, then I think it's kind of interesting and fascinating to think then, how are you going to actually have victims converting? How are you going to actually have success with these cases? And I know some cases have been converted. I know in some of the teams that I work with, they are converting. And again, I think it works when they're being really intentional about not considering these delayed cases or cases with no good evidence anymore or cases where the victim may or may not want to participate, but considering them as newer cases per se, and then implementing your response once they decide to convert, just as you would any other normal response, knowing and the caveat that you will have some other considerations in place. I really want to be fair on that. All right, so we're going to end here with Jessica. And Jessica, can you just share your perspective of outcomes and lessons learned, and just share what are some of your lessons learned?
Yeah, definitely. Some of the lessons that we have learned and that I have learned specifically is having some protocols and other options available for the team to really process or chew on, and also sending that information out beforehand for the meeting so that they have time to process it and then bring to the meeting what is currently happening in their agency, specific to what we're talking about. When we're working on the agenda or discussing the format of the meeting, to always put those more richer discussions toward the bottom once people are more in discussion mode and you've heard from each one of them at least once or twice. It's really helpful to have something tangible. So the model policies were a great way to put the information out there and for people to look at and review. They all have access to the model policies, but I don't think it was something that they sat down and read over in their free time. So it was really bringing it to the meeting and making it available and going through it as a team, so then we could really have some good conversations about it.
Great. So what impeded your progress? What made it difficult?
The most difficult thing was really the attendance. If our team is fabulous at attending meetings, but in the summertime it kind of dips off because people have vacations and fun like that. So that's understandable. But it makes it difficult to really make the decisions, as all of you know, when you don't have the right people there at the table. So we could go ahead and talk about the medical time frame for a forensic exam, but if medical is not there and the county payer is not there, we're not going to get very far. So that made put a little halt on the progress. Also, if there was too much discussion, sometimes that would really halt the progress, but I'm okay with the discussion because eventually we get to the end where we can make a decision once we've heard from everyone and we've gone round and round and figured out what was the best outcome for our team and what's the best with the resources we have available. And yeah, too little discussion, obviously. If the team's not willing to talk, we need to figure out a way to get talking about the conversation at hand.
Great.
That would be what impeded our progress.
Okay, thank you. We're just going to end by sharing a few resources, and then we're going to take some questions, and some great questions have come through. So here's a couple resources. Those Minnesota model policies, the link for that. The End Violence Against Women International, which has a whole webpage devoted to this, and templates and tools and frequently asked questions and other resources and tools for you to use. Also, the U.S. Department of Justice, OVW, has a toolkit, and that link is there as well. So finally, how to sum it up and what you can expect if you do access our Minnesota policies is just a little basics on our statute, those decision points, model policies as it relates to the decision points, and the rationale behind choosing some of the language that was chosen, some of the decisions, for example, the 18-month kit storage duration and things like that are on there, and also frequently asked questions. There are those frequently asked questions as it relates to this, and that is included in this as well. So if you are a leader of a team, you have a really unique opportunity, and I see some of you on the line and some of you on the webinar are already registered for this, but we do have our National Institute for START Team Leaders coming up here in St. Paul October 29th through the 31st. It's your opportunity to connect with each other, sustain, and figure out how to lead these types of initiatives in your community. You can go to that link to find out. The conference is free. You need to make your own travel arrangements, and there is still space available. The conference is a mix of networking, content, and also skills for you to learn through a unique partnership that we have with Global Learning Partners on how you facilitate an authentic, meaningful team process, which can be a challenge for all of us, especially when usually those of you that are leading teams, it's not your own sole responsibility. You're juggling many, many, many different roles and hats. So basically it's going to be how you can wear the hat of the SART team leader and how you can wear it really well, and also the help and networking that's available to you. All right, we're going to end. We have taken note of all the questions, and we're going to get to a few of them. If we don't get to them, we have noted who asked the question. We'll try to also respond in a follow-up email as well. So one question is, I do wish that there was a different term other than cooperate that we could use to describe survivors' decisions to not pursue law enforcement report. Any suggestions? Jessica, do you have any thoughts on that one?
I guess my only thought was using more work with law enforcement, but that kind of goes to the same as cooperate. So no, not exactly, no.
Okay. Well, one thing that I think with this is I think with this process, just how we were talking about writing down and the need for written policies and protocols and so on, I do think that you can start to normalize it. So I think your team can start using, your coalition, whatever setting that you are in, can start using the language. And the language of victims deciding to report or not yet deciding to report. And what happens, I think, is incremental change, it starts to take hold. It starts to give legitimacy to the language. We also convene like work groups of, like for example, the Sheriff Association, our County Attorneys Association, through our compliance project in order to give recommendations and things like that. And we also have found that if the recommendations comes from a multidisciplinary group, comes from a vested process, the rationale is explained, the philosophy behind it is explained, that can really lend legitimacy and can really help ideas take hold as well. It's not always easy. It doesn't happen overnight, but I think those are a couple of options to consider. And here's a question from a Medical Same Safe. When the ICR number is given, is this documented in the patient's medical record? And it is documented in the patient's medical record, and that's one way when the victim does decide or not to report later on, that way they are able to link it back to the victim and are able to give them the full report and so on to the appropriate law enforcement agency. Does Minnesota law include victim reimbursement for secondary care related to the assault, example, STD testing, treatment, physician exam, etc.? For us, that gets into a little bit of the tricky waters. It does state that prophylaxis and STI treatment be included in part of it, and we have also an EC and the ER statute as well that's separate from the exam payment. However, our statute is silent on if it has to be paid for, how much it has to be paid for, the physician exam, etc. So, the quick answer to that is that the victim access to that is included in our statute. However, how that gets implemented gets tricky. And again, the need for sometimes, I think, a statewide advisory board and project to give some guidance to the local teams, to the local SART teams on what would be best practice, what would be the recommendations, the rationale behind it as well, because then you can start, as Jessica said, you can give them a starting point to have the conversations for implementing it in their local community. Do you know how many of these kits actually are converted and prosecuted? We had 100% conversions last year, but 0 prosecuted this year, 0 converted so far. I don't know the answer to that. I know Eva has started collecting some data on that. I know local teams have started collecting some data on that. So I don't have specific numbers in the military. There are numbers, and my colleague here just gave that to me. So in our model policy, it includes stats from the military setting, which we accessed about the restricted kits, and they had a 25% conversion rate for the restricted kits within the military setting. Does that apply to the general community? You know, I think you can make a debate if it does or it doesn't, but I do think what it says that if a good system is in place, there will be the conversions. And I know in some of our local communities, they are starting to keep data as well. And there have been conversions. And in one team that I worked with, there have been 4 successful prosecutions of that. So it is starting to happen. It is starting to take hold. But I know that that change can be rather painful. And it's also would actually just be really nice to know as your team is making decisions what is best practice and what's the best way to go. Here's another question. Is the advocate that the victim is connected with from the agency they report to, or is there one advocacy source? Typically, it's from the advocacy from the local program, but it might be different if multiple jurisdictions are involved. So, for example, if you're in a community where there's both community-based and system-based advocates, it's really crucial to work out those roles because you operate under different confidentiality requirements and restrictions as well. But most of the time when there's a community-based advocacy program, we're seeing them connected initially with the one advocacy source, or if multiple jurisdictions or responders are in play, you're figuring out your linkages and who responds when. And I think we'll take one more question here. And this question, have there been any state jurisdictions whose law enforcement agencies have said that there is simply a storage issue for kits? Are they not needing refrigeration? If so, how were they able to deal with this? Absolutely. We hear that that's an issue in Minnesota and across the country. Creative solutions are being found. There's additional space that's being found. Sometimes there's small funders and grants that can be written for this. We know that's a hot button issue nationally, so something that many funders have heard about it. In one jurisdiction, for example, in those counties where there's multiple law enforcement and maybe there's not space, in one of the law enforcement, we have one jurisdiction where the sheriff's office is holding everything for all the other law enforcement agencies. It's in southern Minnesota because they do have the space. So maybe one law enforcement agency doesn't have the space, but usually somewhere, somehow in the community, there usually is one entity that does have the space. So that was a really great solution. Instead of each individual law enforcement agency holding it in the county, they came up with one county-wide storage space. Some hospitals do hold the restricted kits due to greater availability of space. That can work, but you really need to spell out the needs of the storage location. You really need to work with your law enforcement and prosecution in order to ensure the chain of custody so that if the case eventually is prosecuted or pled out, whatever it may be happen to it, there is still that chance of success for law enforcement and prosecution. And with that, I think we will close out the webinar. We were not able to get to all the questions, but again, we do have them documented, and we'll follow up when we can. Jessica, do you have any other final words? Thank you so much for joining us.
I do not. Thank you all for joining.
All right. Good luck to you and your communities.
Thank you. Please stand by.